Good day. With this recording, I'm going to give you feedback on the practice bank that I've given you, the cervical spine practice bank, and there's 10 cases that I've included. So please ensure that you have completed the opinion form. Keep that at hand as you review the feedback. So the first case that we have is that of a patient who was in a car accident and has cervical spine tenderness. I think I'm just going to that's a little bit better. So we only have one single view for this case. If we look at the alignment with the anterior vertebral body alignment, you can immediately pick up, so this is C1, this is C2, that there is a malalignment at the level of C2. If we look at the posterior vertebral line, there's also a small step there as well. And then in terms of the bones, it's quite obvious that there is a fracture, and the fracture is at the anterior inferior vertebral body. And this is a flexion type injury, which is one of the most severe flexion type injuries. So your description here then will be that there is a avulsion fracture at the anterior inferior part of vertebral body 2. There's no other fractures visible. And then there is also a malalignment as well. And we can see that at the posterior vertebral line. This is, of course, also described as a flexion teardrop fracture. So we have a flexion teardrop fracture of C2 vertebral body. The next case is that of a patient who was also in a car accident and the airbag deployed, and now there is diffuse cervical tenderness. So if we look at the AP view and look at our spinous processes, they seem fairly central. And then if we look at the vertebral bodies, there's no significant drop in any of the vertebral bodies, and there's no evidence of any fractures on this AP view. On the lateral view, so if we look for any evidence of malalignment, we can see that the anterior vertebral line, the posterior vertebral line, the spinal laminar line, all seem intact, and there's no fractures of the spinous processes, and the soft tissue seems fairly normal as well. And then the final image that we have is the open mouth view. And we can see that the lateral masses line up quite neatly here, and there is no discrepancy. There's maybe a slight rotation here, but there's no major discrepancy that would indicate something like a Jefferson's fracture, and also nothing that would indicate that there is a fracture at the odontoid as well. So this case is quite normal. So it's a normal case. The alignment is normal. There are no evidence of any bony injury or any soft tissue injury. The next patient is that of a patient who was in a high-speed car accident. And there are two views of the lateral, and it just shows that sometimes it's really tricky to get decent x-rays of the lateral view, especially when a patient's neck might be in spasm or they might have broad shoulders. So the first image is of the top part of the cervical spine, and that appears fairly normal. There doesn't seem as if there's any issues around alignment or any evidence of any fractures there. Let's just have a look at the second image. And this one, I think I'll just make it slightly lighter. Yeah. So on this image, so if we count, that's 1, 2, 3, 4, 5, 6, 7, we can see that there is a big step from C6 to C7. And this is if we look at it, very difficult to measure accurately, of course, as these are JPEG images, so we can't do an electronic measurement. But if we look at the movement, it's around at least 50%. And that would then indicate that this is a bilateral facet dislocation of C6 on C7, because there is at least 50% movement. Very difficult, of course, to see the rest of the bone because there's quite a lot of artifacts across the spine, and this patient would obviously be referred for a CT scan as well. So the main finding then is a C6-7 bilateral facet dislocation. The next case is that of an elderly patient who had an unobserved fall and has been referred for cervical spine. And again, there's only one image available here. So let's just, it's a little bit better. So it's quite clear that there are some marked degenerative changes. However, when we look at C1 and C2, we can see there is a big step from C1 on to C2, and that indicates that there is a dislocation. It can also be described as an atlantoaxial dislocation. So that is the main finding then with this patient, that there is an atlantoaxial dislocation of C1 onto C2, and that there are some marked degenerative changes throughout the cervical spine. The next patient is also a patient who's been in a car accident where the head was forced against the windscreen and now has cervical tenderness. So on the AP view, just quickly. So if we look at the AP view and we look at alignment, difficult to see on the left side, but it appears as if the lateral masses seems okay. However, on the right side, if we should draw a line, we can see that the lateral masses of C1 is overhanging the lateral masses of C2. And also when we look at the lateral margins of the odontoid, we can see that the distances are unequal. And this is in keeping with a Jefferson's fracture. What we see at the base of the odontoid, which might give the impression of a fracture, is what we call the Mach effect. So that is not a fracture there. And then if we look at the second image, which is a lateral view, we can see that there is a fracture of the posterior arc of C1. So these findings are then that we've got a C1 fracture with malalignment of C1 onto C2's lateral masses. There's a fracture through the posterior arc of C1, and this is all in keeping with a Jefferson's fracture. So the next patient that we have is a patient complaining of headaches and chronic neck pain. And there's two images that's been taken. One has been in flexion, and I think the other one was with extension views. So the one thing that one has to also assess is whether there is any instability around C1, C2. And so you want to look out for atlantoaxial instability. And to measure that, one can do what they call is a power ratio, and to measure the distance between the Bayesian and the posterior spanolaminar line, which I will show to you now. So the first line is this line, which is drawn from the Bayesian and the posterior spinolaminar line. And then the second line is drawn between the opisthian and the anterior arch, which is this line. Now, unfortunately, as these images are JPEG images, so you don't get millimeter measurements, I've actually gone and measured it. The first line came to 3.1 and the second line to 2.8. And if you divide that, it gives you a ratio of 1.1. So normally when you look at the power ratio, a ratio that is greater than 1 would then be suggestive of craniocervical instability, which is suggested in this case. However, it's really tricky to measure on plain X-rays because it's difficult for the measurements to be done, and much more better than this is done on a CT image. The next case is that of a patient with chronic neck stiffness and pain. So if we look at the vertebra, the vertebral bodies are quite squared. We can also see that the anterior longitudinal ligaments are calcified, and there's also increased sclerosis of the vertebral end plates and the vertebral disc, and all these findings are in keeping with ankylosing spondylitis. So the next case is that of a pediatric patient with neck pain and no history of any trauma. So it's quite obvious when we look at this lateral view that the posterior arc of C1 is virtually non-existent. So this is a hypoplasia of the posterior arc. We've still got a tip there as well. So you could have total agenesis of the posterior arc as well. And this happens during normally between 3rd and 5th years of life, where there's failure of ossification of the posterior arc. So this is a quite rare congenital condition. For the patients, they don't always are aware of it, but they are at risk if there's any injury, and it doesn't have to be major, that it could lead to quite significant instability in that area. So basically we have hypoplasia of the posterior arc of C1. So the next case is that of a mine worker with increasing neck pain. When we look at the AP view and look at our spinous processes, it seems fairly okay. You can see there are some chronic changes going on here, but nothing that really stands out. And then if we look at the lateral view, let's just play around a bit with it. And I'll just zoom in a little. Okay, so if we see that is C1, C2, C3, 4, 5, 6, 7. We can see there are some congenital degenerative changes. But if we look at the spinous processes, so that's 1, 2, 3, 4, 5, 6, 7, we can see that there is a fracture of C7 spinous process. And that fracture is an avulsion fracture of the spinous process. It has an oblique appearance, and this is very typical of clay shovelers fractures. These fractures can also be vertical, or it can affect also C6 as well. So C6 and C7 are quite common areas for clay shovelers fractures. And these fractures are often caused by acute flexion of the neck when there is an excessive muscular load. And this is probably something that would be occupational with mine workers, where they do quite a lot of drilling, and there's quite an effect on the muscular load on the lower cervical spine. So we have here then an avulsion fracture of C7 spinous process, which is in keeping with a clay shovelers fracture. Our final case then is of a patient who was in a car accident with acute neck pain, and we can see once again this appears, if it's a more elderly patient, there seems to be quite a lot of degenerative changes going there. I just want to rather go to the other view that we have, which is of the open mouth. So when we look at our lateral masses, they are fairly aligned with each other. The distances are okay. However, when we look at the base of the odontoid, so this is not a Mach effect. There's a fracture at the base of the odontoid. So that is also an unstable fracture. So odontoid fractures are in three types. Type 1 is at the tip. Type 2 is at the base, and then the type 3 fracture extends through the base to the body of the axis. Now, a type 1 and type 3 is fairly stable, whereas type 2 fractures are unstable fractures. So this then is a fracture through the base of the odontoid, which is a type 2 fracture, and it is also an unstable fracture. Okay, so that concludes the feedback on the cervical spine practice bank. As always, if you've got any questions, please feel free to email me or to email Tony also if you want to, and we will get back to you. Thank you.